When a disaster occurs, of course, there are a lot of things happening all at once. There has the potential to be a great deal of confusion and potentially not enough resources for the problem.
There is simply an expectation by the community that we will always be there for them, all right, along with the first responders.
What we did is we organized an exercise based around our helipad to simulate a helicopter crash. We were able to test people with a live timeline responding with the same stressors that they would have had to respond to if it were an actual event.
It's like first, second, and third degree burns to her arm, some burns to the side of her face.
The day began with a briefing first thing in the morning with members of our evaluation and controller group. These were people who were assigned to observe the operations at every possible level during the exercise, and also to provide information to what we call the exercise players, or people who are actually responding to the exercise, providing them with just enough information so that they know what the next steps are.
The briefing this morning was great. We were able to see everyone that was going to be working together for the day, representatives from police, fire, EMS, our own internal employees. It was really helpful to understand what was going to happen.
Following this very short briefing, we brought in members of our incident command team, as well as departmental managers from the emergency department, surgical services, intensive care unit, security, and other departments that were involved in the exercise to give them an overview as to how the morning would go during this exercise.
So my role was to coordinate the efforts of the incident command team, and as different scenarios presented themselves, to make sure that we weren't working in silos and that each person had their responsibility.
During this mass casualty drill, I was assigned to Operations Section Chief. It was my first time at this job, and my job was to make sure patient flow was the best it could be through the organization.
Towards the end of the briefings, we brought in the community responders to again do an overview of the exercise, have people meet each other. We introduced ourselves during the meeting so that everyone knew where they were from. While this was going on, members of the Nashua Community Emergency Response Team, which are a group of volunteers that respond to disasters, were in the room right next to us being prepped as actors who were going to be casualties in this event. And were given scripts as to how to respond based upon their injury or their role in the exercise. Some of the folks were lying on the walkways, semi-responsive, and we had some folks who were actually more of the concerned types who were at some point prompted to respond with hysterical type responses, which is what would occur in a real event. Towards the end of these briefings, everybody was then moved to the helipad to observe the layout of the helipad, and once everyone was in place, the helicopter protocol used by Southern New Hampshire Medical Center was then activated.
This is from Southern New Hampshire Medical Center. We're going to need a med flight for a patient to transfer.
This brought in Nashua Fire Department, Nashua Police Department, AMR ambulance, as well as a ground crew from Boston Med Flight helicopter. The crash was simulated. We allowed Nashua Fire, Nashua Police, and AMR ambulance to proceed with their normal operations.
Were you on the ground when this happened?
You know, the Boy Scout motto is be prepared, and you really can't ever plan for something on paper if you haven't walked through it and experienced it. You can't know what some of the complications will be when you encounter them.
This is Linda. She's 54 years old. She was on the ground when the helicopter crashed. She's sustained some looks like some first, second, and possibly some third degree burns to her arm and the side of her face. We don't have any respiratory involvement, but just for comfort measures, we're going to go ahead and put her on some oxygen. She's been triaged primarily in the field before we got on scene, and we're just continuing care right now. So before
we are very fortunate in the city of Nashua that we have two hospitals that collaborate very well together. We also have another private physician organization that collaborates with us. We work very closely with public health, very closely with the first responders. We are very fortunate as a community to not have those barriers when it comes to responding to emergency management issues.
The emergency department received patients from this event,
All right, Linda.
One of the things that makes my job so much easier as a physician in the community is to have an affiliation with Mass General, our tertiary partner. I can tell you that one phone call makes my life a lot easier because their resources are immediately available to us, the acceptance is instantaneous, and they can oftentimes help us coordinate some of our sicker patients. In the event they might not be able to accommodate a patient, they can help me access resources within the Boston system generally in the event their beds were not available.
And our incident command team was set up in our alternative incident command center to receive information from our controllers and evaluators that prompted them to respond to different types of what we refer to as injects during the exercise and to test their response to those injects. So as an example, the operating room was prompted to call the incident command team to find out how many patients there were. The test there would have been for our liaison officer to connect with somebody at the scene to get a report on that. And so there were injects that prompted the team along down a specific path so that they could then manage the organization during an event like this.
So my role during the incident was to establish communication between the outside and the incident command center. I spent my time talking back and forth with the liaison officer on the ground where the helicopter was, as well as communicating with our CEO, letting him know what was happening, and with the City of Nashua and other outside agencies.
As public information officer, my role was to ensure consistent communication from the hospital to our external partners, community, media, and also our patients.
Once the exercise was over, we brought all the players, all the controllers, all the evaluators, all the departments, and some of the news media in for what we could term a hot wash, where everyone had input as to how they thought the exercise went, what the strengths and weaknesses were. We had a bite to eat, and everyone also was asked to write down their thoughts on participation forms, which we use as part of developing our after-action report. This report, once it's finished, will then be shared with all the people who participated in this event.
My feeling is the biggest takeaway from this process is that it's not the technical aspects of what went right or what went wrong during the day. It's about the community working together as one to be able to make the right decisions together.
During this drill, I felt that we were very connected to the community and that they have our back. Nashua Fire, Nashua Police, and they know that we have their back. And it was a great coming together of specialties, people that are highly skilled and a highly skilled team.
These drills actually give us a great opportunity to see how everybody works together.
We work with all of the other agencies to make sure that safety is first for the responders before we get to the patients. So the fire has to be extinguished, the hazard has to be mitigated.
Each individual organization has its own functions to perform at an event like this. And that's actually why we have these events, is to continue to make those relationships work and to improve on them.
As an organization, I wanted this exercise to show our strengths. I wanted this exercise to show our flaws so that we could work on both of them and eliminate the weaknesses and expound upon the strengths to assure our staff that we are ready for an event like this.